Welcome. My name is Corinne Waldo. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for attending this week's Cross-Industry Safer at Home update with Boulder County Public Health. We're going to continue having these weekly updates into the foreseeable future as things continue to change at the state level and locally, and our numbers continue to fluctuate. I'm going to hand it off right away to Jesse Rounds with Boulder County Public Health to give you updates. But per usual, if you have questions, put them in the Q&A or the chat, and I'll make sure to ask them on your behalf. Thank you.
Thanks, Corinne, and thank you everybody for joining us today. I'm going to try and maintain my volume this time so that I'm understandable the whole time. To just jump in quickly here, I'm going to go over our county case updates, some epidemiological information, and then get right into the new statewide dial that is causing a lot of, or bringing a lot of attention, and I think it's gonna be an important and valuable tool for us going forward, and then we'll get to questions. So this is a somewhat upsetting chart of the 7-day moving average of new cases across the metro area, and you can see that we are in red, and that may be appropriate. We are now in the metro area. We have both the largest as a per 100,000 population, as well as the largest number of new cases, raw numbers, just new cases. And that is, okay, we need to get louder. The other chart that I regularly show is the 5-day moving average of cases. And as you can see, we are way above where we have been ever. You know, we're in uncharted territory here in terms of new cases. That's something we need to address. Just grabbing the statistics here, we were on August 26th, we were about 7.2 new cases per day. For the last 5-day rolling average daily case count was 62.4 cases per day. So huge change. And as many of us know from looking at the news, that high increase, or that increase is mostly hitting the 10 to 19 and 20 to 29 age group. And there are reasons for that. So what we're seeing is obviously a rapid increase in the number of cases, and we're seeing geographic limitations. Most of these cases are CU students. So at this stage, we're seeing the city of Boulder with most of new cases, and our other municipalities and the unincorporated county with very few new cases. My note here about case overload is really having to do with our ability to track and really get into the rich detail of these cases, which helps us understand where to put our resources. So as the number of cases has increased and our resources have been stressed, it takes us a little bit of time to catch up from an epidemiological perspective on the statistics, the demographic information that helps us target our healthcare effectively. So we're working on that, and I think that we have a lot of tools coming online that'll make that a lot easier. The state is helping us. I'm not concerned about that. I just want to make everyone aware that these rapid increases do have an impact on our resources, hospitals' resources, and obviously the lives of the people who are affected. In terms of public health order updates, state mask order was extended again by the governor, and the big upcoming changes, and this is where we're going to jump into the conversation about the dial. And the way the dial is basically a recognition that the safer at home metrics and guidelines had a lot of room in them to allow for, or did not have a lot of room in them to allow for specific conditions in counties. And so this new idea provides essentially 2 additional levels within safer at home. Most counties are now and will likely be for some time in level 2, which is basically where those regulations are the current regulations by and large. Um, Going up the dial, if we see improving statistics, we'll go to level 1 and possibly at some point to protect our neighbors. And those really have to do, going that direction really has to do with increased capacity of spaces. It doesn't really change the requirements for masks and cleaning and the daily reality of having to wash our hands and socially distance as we have been for months. Um, the opposite direction, level 3, means reduced capacity in indoor spaces and in for outdoor functions. And then worst case scenario, we could go to stay at home, which would be going all the way back to March and April, where businesses had to close and all of that sort of thing. So we do want to be out of that. And on the state's website, there is a link for county status. I won't click on it on this one, but I will say that generally the metro area, including Boulder County, are in level 2 concern within safer at home. And we obviously want to be, maintaining that or moving in the opposite direction in order to protect the community. So just a little bit about how they define moving between levels. The way it'll work is every 2 weeks, the state will look at the statistics for every county, every local health department, and will, if you meet these metrics, you'll move up or down out of your current area. So, for example, right now, if we have between 75 and 175 cases per 100,000 over a 2-week period, that's our average over 2 weeks, then we stay in safer at home level 2. Same with our percent positivity, which I have put on previous slides earlier in the epidemiological details. We're still under 5% positivity for our testing. So that's a good sign. As you can see under positivity, that would put us in safer level 1. And then the hospitalization is really important because it means our hospitals are able to deal with the day-to-day severe health crises that people have all the time without the virus. So moving in the right direction to stable or declining hospitalizations lets us move up that table. In terms of each industry, I'm not going to dwell on this too much, but I just want you to know that on the website, just like it has been in the past on the covid19.colorado.gov website, every sector has a what is allowed under each level of the dial, or each point on the dial, all the way up to protect our neighbors. So, right now, again, personal gathering size is 10 people, and like most of our school districts, they're sort of a hybrid in some cases, all online in some cases. Higher education is the same. Places of worship are at 50% of capacity, or 50 people, with the possibility of going to 100 in larger facilities. Restaurants are at 50% capacity, and really that's gonna stay the same all the way up. Although if you have a large enough space, changes as you go into less restrictive levels of safer at home, as well as into protect our neighbors. One note here, if you look at the chart, these asterisks on various items means that that number, that max capacity, goes up by 50 people every month into the future, as long as you maintain in protect our neighbors with the numbers in protect our neighbors. So just a little detail there. Don't want to dwell too long on any of these. I think the next piece of information I wanted to get to was the University of Colorado, along with Boulder County Public Health, announced a 14-day quarantine period for students who live in Boulder County. This does not affect faculty or staff. And in some ways, it's as if the university is putting its students back into stay at home. They need to stay at home. They need to remain in their residence unless they are attending class or other school-related functions, obtaining food, medicine, or medical care, going to work or taking children to school or childcare, and exercise. That was sort of what we were living under stay at home many months ago. And you know, the county was very supportive of this action, just a way to remind the students that they are part of this community and they're having an impact on it. So I think that's an important step, and we are eager to see how that impacts the positivity rate. Other things, I bring this up every week, masks. As I mentioned before, the mask order has been extended. You need to put a sign at the front of your business reminding people that they need to wear a mask inside. Your staff needs to ask people not wearing masks to leave the premises. You know, the order makes it clear that they are not allowed indoors without a mask on. You can provide alternatives. If someone can't or won't wear a mask, you can provide online ordering, you can provide curbside pickup, those sorts of options. You have the right to deny anyone who can't or won't wear a mask, whether they have a note from the government, which they don't, those are fake, or whether they have a button that says, I can't wear a mask. They do not have a right to be in your space if you do not want them there. And that was determined by the state. So I put this slide in last week, and I want to remind everyone again, employees must wear masks at all times while working. They need to be, when they're indoors in a public space, they need to be wearing a mask. If you have students who you employ, or you have customers and you know you have a good chance to message to them, please do that. You know, help the community out. We're reaching out. The CU is obviously reaching out. City of Boulder is reaching out. The more we can get to these younger residents in our community and let them know that their actions have consequences, the better it will be, hopefully, in the long run. And then just simply continue to promote hand washing and social distancing. With that, you know, we are going to continue to have these. I was talking to Corinne this morning. I think we're going to be seeing this through October. We're going to be hoping that we'll move up that dial and we'll have good news for you each week, but please keep tuning in. We're going to keep trying to highlight important details in the dial, in our guidance each week at the 3 p.m. call. And then the 4 p.m. call, I'm sorry, I didn't update this slide, so please excuse me. The 4 p.m. call today is for houses of worship, and we have not determined a session for next week. Corinne and Lane and I will get together and we'll hopefully have one for next week. So again, this slide is incorrect. There is a session this week. It's for houses of worship. If you're interested, I'm sure you can still jump on that call. And there is a Spanish language session. It's recorded in advance and released in collaboration with the Latino Chamber. It's released on Thursday. So please avail yourself of all those opportunities to learn more. And with that, I know there was a lot of information on those slides. We can talk about them. We can talk about other issues. Yeah, happy to answer questions.
All right, thank you, Jesse, for providing that. So we're going to talk a little bit about the dial. I think people missed when you talked a little bit about what level Boulder is right now.
I can go there.
Yep. So although it's pointing to the green, Boulder is currently at what level?
Yes, sorry. This is a graphic from the state. So.
Yeah. So the Boulder is currently at what level? And can you explain that what that means as far as status quo on what we've been teaching them up to this point?
Yes.
And you know what the one metric we're most worried about might be within that level.
Sure. So we are at level 2. Ignore the dial down here at the bottom of this graphic. We are at level 2. We're basically the center of safer at home. That's where most counties are. I will actually see if I can click on this and take you to a map of the whole county. Let me see if I need to share. It's loading. Um, Let me see here.
So we still see your PowerPoint. Oh, there we go. We're good.
Okay, so this is obviously a map of Colorado. The yellow is our level 2, and you can see most of the metro area is in that level 2. Some counties are in level 1, and a number of the less populated counties have been able to move to protect our neighbors. And obviously that is in terms of access to businesses, that's our goal. But really our goal is to be protecting our residents and making sure that everyone, that we're reducing the impact of the virus. I will go back to my screen. And Corinne, you had some other.
So being at safer level 2 means that's basically the safer at home in the great vast outdoors, what we would have considered the status quo of safer at home, what we've been covering every week up to this point. So we're at that level right now.
Yes, yep. And here I will go to so this is, and I maybe have moved past this a little too fast. This is how the state is going to define where you're going to move and what metrics. So within safer at home, and if we backslide all the way to stay at home, they're really just looking at these 3 categories: new cases, percent positivity, and stable or declining hospitalization. That moves you within safer at home and also back to stay at home. To get to protect our neighbors, you still have to meet those 8 metrics that we've talked about in the past that we will be tracking on our website. And I should mention, we'll be tracking both our protect our neighbors status and our status within the safer at home levels on our website. I don't believe that's up yet. I know that this all just came out yesterday, so our public information team has been working overtime to try and get a status website up so that the public is available to that.
And I know Lane wants to add something here, but just to really quickly, I did put into the chat the site that tracks the metrics for Protect Our Neighbors. There will be a similar site, as Jesse said, tracking metrics for this dial within the Boulder County. I also put a direct link to this dial website on the state site, which I will send out in the emails. Go ahead, Lane, you were going to add something.
I think you had also asked about what's changing for us right now, and the answer is nothing. The safer level 2, the concern level where we are, is where we were prior to the dial coming out. So when you look at all the different allowances, those are the general where safer at home as was. They just added a better level and a worse level. So as of right now, nothing is really changing for us. And then we'll be looking to see when we potentially qualify, hopefully to go in the positive direction and not the negative direction. But right now we are seeing increased hospitalizations.
Okay. So the new cases, we have a question about that's greater than 75 to 175 per 100,000 over a 2-week incidence. Is that per day or is that over 2 weeks?
My understanding is over 2 weeks. Is that correct?
Yeah, and we, I think, are actually better than that. We're better than the 10% positivity. We're actually below 5%. So in some of the metrics, we're still doing very well. The overall initial, we're showing a different metric. I think that's something that we need to be able to get from our epidemiologists now that the state has this 2-week incident, because what we've always been showing you is our 5-day rolling average. That's not apples to apples here. So we need to be able to get that for you.
2-week rolling out.
And I think we're heading towards the upper end of that right now, but I need to see that exactly. Our 5-day rolling average is 62.5 new cases. So again, it's not a 2-week incident. So we need to be able to get that to show you. But again, we just got this safer at level, all this stuff really just in the last day. So we're trying to get our heads around it so that we can articulate it to everyone.
So, and then this is also then, it's then created per 100,000. So it's one of those metrics that I would suggest once Boulder County is able to create a tracking mechanism that you then go ahead and track and follow, just like we have to protect our neighbors. Are we hearing concerns regarding RTD? We have a rider on the line who's felt good, but found that drivers aren't making riders keep masks on. And is it a requirement to wear masks on RTD?
Sorry,
I
go
can
ahead.
just say that we haven't heard of complaints or outbreaks. That being said, a lot of the cases that are investigated, it's very difficult to establish the exact place where someone was exposed and where they got sick unless they know they were part of a large outbreak where everybody that was at a certain location all got sick. So we haven't pinpointed a lot about where every individual case is coming from because they've had lots of potential exposures typically. And then I think the other question is, yes, people need to have a mask on.
Okay. And there is guidance on the state website specifically about public transit, and I believe that the Boulder County site does link to it. I actually had to send it out to somebody yesterday. So if you have specific questions about the guidance that's required for public transit, I'm happy to point you in that direction. Just give me an email. So let's go back to the CU order that came out again last night. A lot happened yesterday. I'm glad these webinars are on Wednesdays now and not on Tuesdays. We do have a question from one of the exemptions is that students can go to work, but we do have a question from a few businesses that employ CU students. Are there any restrictions around that employment? Anything that the businesses need to take into account when those students come to work? Or anything that they need to take to worry about?
There's been no additional guidance to that effect. I mean, if they're wearing a mask, washing their hands, socially distancing as much as possible, obviously some jobs you can't do that part, but if you can do it as much as possible, you're going to be able to maintain that level of safety. But I don't, Lane, unless you've heard something different, I haven't heard anything about specific restrictions related to how employees need to be treated if they are CU students under this quarantine.
Yeah, I think the other piece that's still required of all employees is that screening. So that's really essential. Certainly you can verify that they are not part of a quarantine or isolation order, that they haven't been part of an exposure. But certainly if they have not, then those other precautions are still what are being expected.
So another question about the CU Boulder Order. What level of outbreak needs to happen for CU to potentially shut down and go to online classes only?
Well, again, this really is sort of moving to that shutdown as far as the activity of students. The concern has not been classes themselves, it's been activity outside of classes. So, I guess the parallel would be if we shut down the school, we're not evicting everyone from Boulder County. So again, it isn't quite the same as shutting down a business where we're not ever having people who are, if a business is shut down, they all need to now leave our county. So shutting down school could be counterproductive. That's one of the concerns, is if all the students have less need to be in class, they may have more time to be out and about. So, And again, I don't think the risk is the classes themselves. That hasn't really been a concern. We have not seen a lot of instances and outbreaks related to classes themselves. It's been other activities. So that's really the focus.
And, I think we've gotten a couple questions about, number increases have been tied to CU students. Some have not been tied to CU students. They've been tied to community as well. But why should businesses across Boulder County, why should citizens across Boulder County, care about what's happening at CU? And I think, and how do, why is it not just incubated at CU? Why should we all, why are we all part of this full system?
Well, we're a community. Some of those students may work in other communities. They certainly may shop in other communities. There are revenues that are generated from all those students being here are a benefit to the business community. So there are certainly the positives and the negatives, but right now they are in basically a stay-at-home order for the students. So they won't be out for just general activities. They shouldn't be out mingling. It's really focused on things like essentials, getting their groceries, going to the doctor, going to work, but not out for casual pieces. So again, I think that's the goal, is so that it doesn't continue to filter into our community.
And ideally, that came out at the same time the dial came out. Ideally, as a community, we want to move up the dial into safer level 1, cautious. So as a community, we benefit from better numbers and higher occupancies and greater openness in some ways. Sorry, still have that cough, but luckily, again, because we're protected via camera, nobody on the call I'm not contagious over camera. Another question about the dial. When we move between these levels, now we know we've talked about how we're at safer level 2 concern, and that's status quo. That's what we've talked about, every week probably since, around April 30th, with some changes. If we move up to safer level 1, cautious, you mentioned this, it changes occupancy, but will it change things like, health checks or, the screenings, or, social distancing or masks, or some of those requirements that we have in place under the orders that are currently in place?
No, no changes will come to it. I mean, it really is just capacity. Those health checks, masks, social distancing, those are the effective combatants against the virus. Excuse me.
You got my cough. I'm sorry.
Terrible. But no, it is really just capacity, and it really, it's sort of it's a recognition that a community has reached a level where, as a community, we're controlling the spread of the virus, and there's a possibility to have more people in any given space. And again, it does not require that businesses go to that level. If a business feels like they need to stay at a lower capacity or something like that just for safety, then they're allowed to do that. And I really do think, we do need to think about what is the impact of increasing capacity as well. So we do want to move up. We want to move to a safer level 1, but it does have, it means that we're again in a sort of more people in one space that has consequences. It can have consequences.
Okay. So knowing that we're probably going to be following some of the same guidance into the winter months as we enter, the new seasons, we're probably going to need to start thinking creatively as retailers, as businesses, about how we handle the new season of goods. I had a question this week from a thrift store about the bin of hats, how you handle those types of goods this season starting to think through the way to handle it in a COVID world. That social distancing, not sharing of products, the quarantining, those types of things. How how should we as a community do some of that sharing? Should we use these webinars? Should we ask questions, do some sort of, what should people ask themselves when they start to enter these new seasons? I know that people call me a lot of times. I'm like, what should I think about? But what are some of those questions they should ask themselves as we enter these new seasons?
That's a really good question. And I don't know if, I do know that what we really need to think about is, okay, we need to be more indoors, or are there creative solutions for outdoor spaces? What do communities as a group need to ask themselves? So, for example, one of the things that comes up a lot is restaurants have had the opportunity to use outdoor spaces. What does it mean to use outdoor spaces when it's 35 out and snowing? Or what does it mean when it's really windy? And that two things. That means talking to your peers in whatever industry you're in about their indoor outdoor spaces, but it also means working with your municipalities. Public health doesn't control those public spaces in terms of your use of those public spaces, but talk to your city council, talk to your elected officials and your city departments about what is allowed and whether you'll be able to use tents in the right of way into December. I mean, there's going to be snow plowing. But I think also, Corinne, one thing that you and I have talked about and has come up in a bunch of other conversations is Halloween, Thanksgiving. These, not only these, important cultural times, celebrations, holidays that we have, but also what does that mean for retailers? What does that mean for our families? So we do need to start thinking about all these things. I will say that we've been thinking about that. We've talked to the state's talking about it, but it's worth talking to your peers about.
I just think one other piece as the weather gets colder is we definitely know that the risks are much greater indoors than outdoors. So it really is going to be important for businesses that have done maybe more outdoor to being very vigilant in screening employees, making sure they have masks for their employees, that patrons are wearing masks, people can social distance, you're not crowding those spaces, because again, our risks are going to go up as more things are driven indoors. So
okay, so as we head into the winter months, seeing this framework shows us that we're going to be following a lot of the same guidance moving forward. So we need to start talking with our peers, talking with each other about creative solutions as we move inside to stay safe, to be able to stay open and not move down the dial. I think that final question, and I think this might be on people's minds, what happens if you move down the dial?
I think moving to that high risk level, that safer level 3, we're going to be reaching out to everybody. We're going to be trying to communicate that we've got lower capacities. And really the whole point of that is not to punish the community. It's to try to get the spread of the virus under control so that you can move back up the dial. And that's why it's reevaluated every 2 weeks, because, the state wants us to move up the dial. We all want to move up the dial. So if we move back, if we fall into safer level 3, then we are going to be looking at communicating as best we can the behaviors and the decisions that are going to get us to move back to level 2 and even up to level 1. There's always the possibility, if there is a significant spread, that we would have to go all the way back to stay at home, and that would have a major impact on everyone's lives. So, but this all comes back to, are you washing your hands, socially distancing, and minimizing your time indoors, around other people outside your household. All those sorts of things are ways to stay in two or even go higher.
I think I'm gonna end at that point unless we have any more questions. I don't see any more at this point. I did send the both of you some new email that went out about new event guidance about guidelines about seated events. So if you could get back to me about that, I'll send the information off to event facilities if the information is accurate under the new dial. I will send it off to those individuals within the events area. Other than that, please stay. We will keep having these. We know that information changes. How we categorize safer at home is changing. Orders are changing. Communication is changing. Numbers are changing. We want to continue to have these for our community, for our health, and for our economy. In between the sessions, do not hesitate to send your questions to Boulder County Public Health. If you can only find my email, please feel free to send it to me. I will send the information about the COVID testing site, which we didn't cover today, the COVID testing site, the dial, and CU Boulder, the CU Boulder site, story, as well as contact information in an email. And then we will see everybody next week. If you happen to be a religious facility, the next session will start at 4 o'clock, and we'll go into detail about places of worship. Thank you. Have a great week.
Thank you.
Thanks, everybody. Thanks, Corinne. Thanks, Lane. Bye.